Hi guys, welcome to the YouTube channel. Have you ever wondered what happens in the body of a HIV patient if they have been diagnosed they are having HIV and AIDS, or if they're having just HIV? Today I'll be telling you what happens in the body of HIV patient and the pathophysiology of the HIV. I'll break it in a simple term which a layman can also understand. In case you're having HIV and AIDS, watch my other videos which will be coming out soon on how you can manage your HIV and key points you should look if you're having HIV and AIDS. Let's get into it. Now, the pathophysiology of HIV and AIDS. Pathophysiology, I'm talking about what happens inside the physiological system, the pathogens and the physiological system, how it occurs, what operates there. Now, HIV, we know is a virus. It comes into the body. We have no substantial care about it. Everybody is scared of HIV. Scientifically, it has been proven that people with HIV have capacity to live more than 50 years. And not only scientific proven, I have seen a lot of articles and I've experienced in real life people suffering from HIV for the past 50 years, 30 years. They are stable, they are living. So what are they doing different? Let's get down to the pathophysiology first. Pathophysiology of HIV is just a simple term. HIV kills the immunity, which everybody must have known by now. What are the immunity? Immunity, these are antibodies in our body which take the responsibility to protect the internal environment of the body. For example, we have immunities in our cities. Let's say, for example, the immunity of our city, which is the police officer, is not in the city or in the village, then there is more chances for harmful substances to come in and penetrate inside our city. Harmful substances like harmful individuals, drug dealers, robbers, gangs, rape, and etc. But the police officials maintain the law and order of every city. That is how our immune system operates inside our internal environment. They maintain the laws and order of our environment. When the bacteria, like I'm talking to you right now, bacteria is just flying in, I'm breathing in. A lot of air is coming in, most of them contain bacteria such as pneumonia. We have things like tuberculosis, they just fly in. So once they come into the body, my immune systems will take care of it, neutralize them. Most countries have the laws saying that you can't travel into their country if you don't have the visa, especially let's say USA for example. So if you go to the border and you cross illegally, of course they will arrest you, they will detain you and send you back to your country. So that is what our immunity do. But our immunity in our body kills the bacteria and we excrete them away. Sometimes they immobilize them and we excrete them. They send them to the excretion process of the body. So that is the basic pathophysiology of the HIV. HIV comes into the body as a virus. They multiply easily on a continued basis. They multiply, and our immune cells, like let's say we have the thousands of policemen in the body, but immunity, like if we're talking about white blood cells for example, is like 4,000 individuals able men, 4,000 to 11,000 if I'm not mistaken. That number has been a long time. 4,000 to 11,000 soldiers, military men in the body. Then let's say the HIV came in and it's multiplying quickly. They're having good gangs. they are increasing in numbers, and if they get to 15,000, they will be more stronger and they will overthrow our gentlemen who are serving. So in that case, our immunity can't withstand. That is why most times the opportunistic infections paving, and HIV do not kill, it just increase and it destroy the immune cells. If you're having 4,000 to 11,000 white blood cells, if HIV infects you, of course it will drop in number, and if it goes below 4,000, you're at risk. It goes below 3,000, you're very in a severe danger, because any pathogen which is coming can multiply quickly, and if they get stronger, of course you'll be infected. In case you're having HIV and AIDS, watch my other videos which will be coming out soon on how you can manage your HIV and key points you should look if you're having HIV and AIDS.